Oh, man. All right. Let's try to continue while that's trying to upload. I got myself plugged in here. Okay, let's talk about a TIA. A TIA is what you might have heard in the past called a mini stroke. Right? TIA is a transient ischemic attack. And when I hear the word transient, I mean just like it would be if I talked about a person. It's a transient. It comes and goes. So a transient attack are going to be like, well, just like little tiny mini strokes. And they don't do a whole lot of damage that you think of, all right? People who have strokes can have lasting effects for the rest of their life. And typically a TIA, you don't see any lasting effects. But what happens in a TIA is I know they're always a precursor to a stroke. So some people might say, I'm just having TIAs, no big deal. They're a very big deal because that could lead right up to a big stroke, all right? So we'll talk a little bit about these if I get my camera. There we go. It says TIAs are caused by a brief interruption in blood flow. This could be caused by narrow arteries and vascular occlusion, perhaps by small emboli or vasospasm caused the interruption. So I've got to think, when I'm thinking about a stroke, okay, of course right now I'm talking about a mini stroke or a TIA. When I think about a stroke, there's a disruption of blood flow. It's going to cause an infarct, okay? An infarct, again, are pretty much dead pieces of tissue and cells, and they don't work anymore. And when that happens to my brain, they don't usually regenerate very well, okay, if at all. So when I have a TIA, it's not going to be like a big stroke, like I have a big clot and it's disrupted blood flow for a period of time. It's going to be just small. Don't see a lot. I may see some minor effects that I would see in a stroke, but very light, and then they're gone, and then I'm fine. All right, but I could be having those quite a bit, and that's not good. The more I start having, the more I know that I'm probably going to have the big one, the big stroke, very soon. So these people who have TIAs can't just brush it off. They are a precursor to a stroke, and they're caused either by an embolus, narrowing of the arteries, because remember, I've got to have blood flow, and you've got to think about all these things that can prevent blood flow to your brain cells. One of those being vasoconstriction, anything like that. What does it say? Occlusion, a vasospasm, anything that's going to keep the certain amount of blood going to my brain. Going on down, let's see here. I'm going to see that during a TIA, the person may feel a sudden weakness or numbness on one side of the body, slurring of the speech or inability to talk, visual disturbances such as blindness or double vision, confusion, diminished coordination. Hey, what's that sound like? All that sounds like a stroke, and that's why we call it a mini stroke. Symptoms are similar to those of a stroke. These symptoms generally last no more than an hour and completely resolve with no residual deficits. Oh my goodness. That's why people just brush them off. All right? But you have got to remember that the big one's coming. All right? Okay, going on down. A thorough history of the event is essential. How it began, the symptoms experienced, how long it lasted. If carotid obstruction is suspected, carotid duplex ultrasound studies are done to determine whether the obstruction is in the carotid arteries to prevent normal blood flow. Go back. All right. So you got a patient that comes in that's explaining this to you. I have to know everything that was going on when it happened. I need to know if there was a trigger. I need to know it all. All right. Where were you at? What were you doing? Were you eating? Were you drinking? Were you smoking? Were you exercising? When it happened, did anybody see it? Did anybody witness it? Did you look in the mirror? What did it look like? How did it feel? Was it numb? Was it tingly? Everything I could ask about it. All right, just get nosy, because that's going to help my doctor help diagnosis. Okay, I've got to do other things to diagnosis, but I need it down to the T on what happened. All right, and that's your responsibility to make sure you're getting all of that done. If they think that it's my carotid, that there's something going on here, that there's a blockage, of course they'll do an ultrasound, just like they would any other blockage, to check to see if I've got blood flow going all the way up to my brain. If I don't, guess what I'm going to get? A roto-rooter in my carotid. I'm also going to do things like blood testing, MRI, and EEG to rule out anything else. It says if there's a near total occlusion of the carotid artery, either an angioplasty procedure with a stent or carotid endarterectomy, roto-rooter, is going to take place. I just love saying the word endarterectomy. I don't ever want to have one, but I like saying the word. All right. So if I'm having an endarterectomy, the purpose of having that is to remove plaque so I can restore blood flow. Easy peasy. Okay? Get the blood flow going back. maybe I won't have to hit the big stroke. Going down to a stroke, this says stroke or brain attack, okay? It says more than, we don't need that. Stroke is the leading cause of disability and the fourth leading cause of death. The incidence is about 19% higher in males than in females. Those statistics might be something you see again. I don't know. It's because strokes are pretty prevalent. When you go out to the field, if you work in geriatrics, you're going to see lots of stroke patients, and I know you have already. Our stroke patients, it's got to be rough. Most of the time, the effects of a stroke last forever. They say that you have about a 6-month period that you can do rehab and get some of it back, but you know, it just depends on how long the occlusion happened until it let go, how long I was actually deprived of oxygen in that section of the brain. It depends on how much your patient wants to put into the rehab. But after about 6 months, or if I never go to rehab, whatever I've got, I'm probably going to be left with. So, and that's pretty sucky. It says control of high blood pressure, number one, because what happens in high blood pressure? Think back to cardiac. All right. If I've got high blood pressure, it exerts pressure on my arterial walls. Remember, I've got this artery that should be going woof, woof, woof. I get high blood pressure. It's woof, woof, woof. And when I put pressure on those arterial walls, it causes little microscopic tears. And guess what happens when I get a tear? I get clots forming on it. And then I get a bigger clot. Then I get plaque stuck to it. And then bam, got a recipe for a stroke. Okay? So high blood pressure. Quit cigarette smoking, decreasing intake of cholesterol, and control your blood lipids. A lot of times I'm having these strokes. People are having strokes because they've got a blockage somewhere. Blood can't get to the brain. Most of the time those blockages are plaque. Prevent obesity and living a lifestyle that helps prevent heart disease and can reduce the risk of stroke. Go back to preventative. Eating your fruits and vegetables. Staying away from cholesterol causing beef, all those red meats, cholesterol meats. If your patient has a family history of cholesterol problems, then they need to make sure they're having routine draws of their cholesterol. I don't know if we talk about HDL, LDLs in here and totals, but just making sure that they're getting the labs that they need. The patho, it says, it talks about cerebral ischemia. Remember, ischemia is lack of oxygen. Ischemia of cells directly causes cellular necrosis, and that's just death. Your cells cannot live without oxygen. If my brain cells if my brain cells have no oxygen, they will die. And then whatever that part of my brain was responsible for, whether it's moving this arm or blinking this eye or talking or whatever, all right, is going to be affected. I will lose that function. Okay? All right. And it's talking about an embolus. Of course, an embolus is a traveling clot. I definitely can have an embolus somewhere else. It break loose and go to my brain. It can go to any organ, but it definitely could be from you could go to the brain. It says, let's see here. Let's get on to something else here. Well, it doesn't say a whole lot in here about having a hemorrhagic stroke. Is it somewhere else? Well, a little bit at the top. I don't know if I'm looking over it or not, but you've got a figure on page 530 on figure 23-1. I really like it. All right, it's talking about different kinds of strokes. You've got your embolus, you've got a cerebral thrombosis, and at the top you see a cerebral hemorrhage. So usually I'm looking at strokes. I'm usually looking any that kind of cause an infarct, which is a lack of oxygen, causes necrosis and cellular death of brain cells. And then I also have a cerebral hemorrhage, which is actually a brain bleed. So when I think about strokes, they're usually classified as an ischemic stroke or hemorrhagic stroke. Either it's been a lack of oxygen or there's been something burst in the brain and it's caused a hemorrhagic stroke. Blood's leaked out into the brain. There's pressure on the cells. The cells that were supplied by that certain vessel no longer have blood flow or oxygen. So I don't see it in the text, but it's got to be in there somewhere. All right. So differentiate between the two. I think I'm going to stop here and see if I can upload this one because they're getting a little bit lengthy. So I'll come back and talk about aneurysms.